Hello guys, good day everyone. Let's talk about the silent killer, hypertension. So a person is said to be hypertensive when the blood pressure is checked on more than one occasion and is seen to be greater than 140 over 90 millimeter of mercury. Now, what are the different things that can cause hypertension or lead to hypertension, of which we call the risk factors? We have increased salt intake, obesity. Someone who is excessively overweight can also come down with hypertension. Lack of physical exercise, people with sedentary lifestyle, excessive alcohol intake, as well as smoking. And stress, yes, stress has been shown to cause hypertension. As you advance with age, you're at risk of also developing hypertension. Other conditions like kidney diseases, as well as any other illness like diabetes mellitus, it can also predispose you to hypertension. Now, what are those signs that you're going to see, or what are those signs they usually complain, signs and symptoms they complain um, most of the time when they come to see us? One of them is severe headache. They usually come with headache, dizziness. They complain that they are feeling dizzy and blurry, as well as them having palpitations. So what they describe as the palpitation is that they are feeling their heart beats excessively. Also, some others people come with severe chest pain. So those are like the different signs. There are many other signs that can come with them, but these are the common ones that occur. So I'm going to be talking about the complications that can arise from poorly managed hypertension. I'm going to give you 5 different causes. If you need more, you can come on my comment section and I'll give you 1 or 2 extra or more if you want. So I'm going to talk about 5 basically. The first on my list is stroke. It's usually occurred due to increased stress to the brain. So I'm going to say the different organs will be affected, as well as even the eyes could also be affected from poorly managed hypertension. So stroke is one of the complications. Heart failure is another complication that can arise from poorly managed hypertension. Kidney problems, the patient can come down with kidney failure, as well as sudden death. The patient can also come down with they just tell you what happened. No, this way, and the patient just died from poorly managed hypertension. So take your medications as prescribed. Let's then talk about the prevention and control. For those who have not gotten it or who don't have hypertension, congratulations. All you need to do is to prevent it by working on your diet, working on your food, and doing regular exercise. And for those who have it, it's not a death sentence. You have to just still regulate your diet as well, reduce salt intake, do regular exercise at least 30 minutes per day, and take your medication as prescribed. Yeah, I know it's not easy, but you just have to. Then you have to also avoid smoking. So if you're a smoker, you know that you're predisposing yourself to the complications that listed above. And also reduce the alcohol. In fact, what am I saying? Stop taking alcohol, not even reduce, except you are so addicted and you are trying to think of how you can reduce it gradually and weigh it up. So dear friends, kindly check your blood pressure regularly, avoid taking alcohol, don't smoke, and do regular exercise. Reduce your salt intake and make sure you're keeping that smashing body. Weight loss is very necessary.